Hi, and welcome to this special edition of Omni Edition Garden City. I'm Dan York, and with me now is Kara Reed from the Maplewood Community Center, who is the coordinator for the Healthcare Navigator program. Is that correct?
That is correct.
And it is open enrollment for the health insurance marketplace, and that's the reason we have Kara today to talk about that. First off, let's always go back to the beginning because people don't always understand what this is. What is the healthcare marketplace? What is healthcare.com? What is the Affordable Care Act?
So that's a great question, Dan, and I know it's really confusing, so we want to make sure everyone's clear. So the Affordable Care Act started in 2010 for President Obama. It's a healthcare reform is really what it is. And it had three primary goals that it set out to achieve. So the first goal was to make healthcare affordable. So that was the first goal. The second goal was to expand the Medicaid program, so the state insurance program. And then the third goal was really to support some of the new medical care delivery methods that were going on at the time to bring down the cost of healthcare.
Okay. So that brings us to now. And how did the program that you're running at the Maplewood Center start?
Sure. So it started about last year, and the City of Garden City was awarded a 3-year grant to hire navigators to help people with health insurance, help them with enrollment, help them with questions they might have about health insurance.
Okay. And that is through the Community Resources Department as the umbrella department that oversees all of this?
Yes.
Okay. So that brought in healthcare navigators, health insurance navigators to the Maplewood Community Center. Those are the folks that are doing the work on these programs and getting people signed up, correct?
Yes, that's correct.
So what exactly are they doing to do that?
So what they're doing is they've went through lots of training to provide the consumers with the answers that they might need about healthcare. They also have been trained on different financial assistance options that are available for consumers in the area, as well as different eligibility requirements that people could obtain. For instance, Medicaid, the state insurance program, we're trained in that and enrolling folks in that as well. But primarily through healthcare.gov, we're trained on how to enroll folks through that website.
So the hope here is that they would be able to, and here's where the term navigator comes in, be able to navigate this project and program better than someone just going on to the healthcare.gov website themselves.
Yes, that's correct.
Okay. And we are in open enrollment, correct?
We are. It started yesterday.
Okay. Explain that to people.
Sure. So the open enrollment period is, as I said, started November 1st. That was yesterday. And it runs through January 31st. So during the open enrollment period, people should come in and either get questions answered about enrollment, or they can enroll during this time. We are encouraging people to enroll before December 15th, even though the end date isn't until January 31st. Because if they enroll before December 15th, then their coverage for healthcare will start on January 1st.
Okay.
So people can come in, or they can go on the website, healthcare.gov, and get enrolled into a qualified healthcare plan through the marketplace. And people that are already enrolled in healthcare plans, what we're seeing is we want them to come back and answer questions. In fact, that last year, like 59% of the returning consumers, they shopped around for new plans, and 60% of them actually did switch to different plans. So if you're already enrolled in a marketplace plan, make sure you come and see one of us and kind of shop around so you can get an affordable health care plan it may be cheaper than the one you already have.
So the theory is that since the law went into effect last year where everyone had to have some form of insurance, medical insurance, and if they don't, there is a penalty, correct?
Yes, absolutely. So there is a fee that is associated by the end of the year if you have a lapse in coverage. So you want to make sure you are enrolled all year long.
So with the open enrollment period, is the primary objective here to get new people enrolled, or is it to allow people to move around and shop for new plans?
I think it's both. Number one is, if somebody is not insured, come in. That's what we're here for. We're here to help people navigate the system, get coverage. And if you already do have a plan, like I mentioned, I know there's a lot of concern about insurance companies no longer being available through the marketplace. So come on in, let us help you find a plan that's affordable for you, and so that you're not re-enrolled into a plan that doesn't fit your need.
And so you mentioned that some insurance plans are no longer available in the healthcare marketplace. There have also been stories on television and in the paper and on the internet that some of the costs associated with getting insurance through the healthcare marketplace have gone up too, correct? What do we know about that?
Yeah, so I know that there's a lot of concerns out there, and that's what this program's really for, is to kind of clear up some of those concerns. So we do know, and what we're seeing on the ground today is that more than 70% of people who are enrolling in healthcare plans are finding plans for less than $75 a month. So there are plans out there that are affordable. So again, please utilize our navigators and make sure that, I would say folks, come on in, get some questions answered. If you feel like there's not affordable plans, let us help you try to find one that might be affordable for you.
And someone who might not realize that they need to look at the healthcare marketplace is maybe someone who has changed jobs and lost insurance, or lost their job and lost insurance, or just had some sort of life change circumstance where maybe a year ago or 2 years ago they didn't need to worry about this, but now they do.
Yeah, so we do see that a lot on, in the offices, where people come in and they have a lot of questions because they might not necessarily have ever had to deal with a circumstance. So during open enrollment, so not during open enrollment,
Sure.
rather, during that time, people can qualify for health insurance. So say it's, the middle of June and somebody loses health insurance because of a loss of job, say, they can come on in and we can help them try to get enrolled because they did have a qualifying life event. And we can try to get them enrolled right away so that there's not a lapse in coverage.
And just so people understand, you are there year-round, not just during the open enrollment period.
Yes, we are there all year round.
Okay. Okay, so if it is open enrollment time, where can people go? Because this grant covers more than just Garden City, correct?
Yes, so the City of Garden City was awarded the grant. However, we do have other locations. We have 4 locations in Westland, Dearborn Heights, and Garden City, of course.
Okay.
So those locations are Westland City Hall, Jefferson Barnes Vitality Center, as well as Dearborn Heights City Hall. So those are the 3 not in Garden City, and then we do have the 1 at the community center, as you had mentioned.
And what phone numbers should people call if they want to find out more information?
So you can call me directly. My phone number is 734-793-1849. And that's to the Maplewood Center, and you'll get me on the phone and I'll help you out.
All right, so the Affordable Care Act and the health insurance marketplace, open enrollment now through, what did we say, January 1st, is that correct?
January 31st.
Through January 31st, so this is an opportunity for people either to sign up that maybe haven't signed up yet, or to look at different plans if they're not totally sure the plan they have is the right one.
Yes.
All right, well, I want to wish you and everybody at Maplewood Community Center the best of luck with this program.
Thank you very much.
All right, thanks for watching this edition of Omni Edition Garden City. I'm Dan York. Good night, everybody.